Cook Government has rushed out a new $50 million hospital maintenance fund and audit of hospital infrastructure following intense criticism and concerns around the state of key public hospitals. As pressures on the health system mount, the Premier continues to lay part of the blame on the Albanese government, saying Western Australia isn't receiving its fair share of federal aged care funding.
After spending the past week defending its record on the maintenance of public hospitals, a major media conference and a different tone.
We understand the anxieties and the concerns of the community. We're listening to those.
I acknowledge we've listened and we're acting. I acknowledge the concerns and recognise the concerns raised by the community.
The political pressure brought by ageing hospital infrastructure and reports of hundreds of work orders for damage and safety issues at Sir Charles Gairdner Hospital, including blocked, leaking pipes and mould. The Premier's sticking by his claim WA has a world-class health system, but
we acknowledge that we need to do more to make sure that our ageing hospital infrastructure gets the maintenance and care that it needs.
A $50 million fund for maintenance at Sir Charles Gairdner, Royal Perth and Armidale hospitals, and an audit of how hospital infrastructure is maintained. Welcomed by the opposition, but scathing of the timing after the government's response to concerns last week.
He says, don't go to hospital, scaring Western Australians. Scaring Western Australians because he sees a small gap of a political opportunity here.
They'll deflect, dispute, deny, do anything other than address the issue until finally they realise, uh-oh, we've been caught out here, we're in trouble, we better do something. And that's what we saw today.
Doctors say the funding is a good start, but won't solve all the problems.
This isn't going to solve our ramping problem, and this isn't going to solve some of the bed shortages and aged care challenges that we're facing, but it's still important and needed to be done.
There was no announcement to address ambulance ramping pressures, but the Premier and key ministers will travel to Canberra to lobby the Albanese government to provide more funding for aged care beds and home care packages. It came after the Prime Minister dismissed accusations the Commonwealth wasn't pulling its weight on aged care in WA.
Well, we've put in the biggest reform for aged care this century.
The fact of the matter remains, though, that Western Australia does not receive its fair share of either home care packages or aged care beds,
adding more pressure on hospitals and families.
Western Australia has the lowest number of home care packages per 1,000 people in the country. What that means is more people are going to hospital.
An avoidable but expensive problem with widespread impact. Nick Perpich, ABC News.